Good afternoon, ladies and gentlemen, and thank you for tuning in today. We received information this morning reporting 2 additional COVID-19 confirmed cases, resulting in a total of 6 cases in Victoria County. We are currently not under a curfew or a stay-at-home order. The mayor and I believe that our current order controlling social gatherings due to this public health emergency should sufficiently slow the spread of the virus here, while also allowing us to balance our community and business needs. We are in constant consultation with our health officials and command staff, and we continue to evaluate all information relevant to COVID-19 so that we are prepared to act if and when additional actions are in the best interest of our community. For local information regarding COVID-19, VictoriaTXOEM.org continues to be the source for accurate and timely information, or via our hotline at 361-580-5796. Today, the mayor and I are joined by Dr. McNeil, our health authority, and David Gonzalez, our health department director. At this time, we'll turn the floor over to David Gonzalez to speak to the newly confirmed cases from yesterday evening as well as this morning.
Thank you, Judge. As Judge mentioned, currently right now we stand at a case count of 6 for Victoria County residents. We did receive notification last night of 1 resident, male in his 30s, who is currently isolated in his home. And then this morning we received word of 2 more hospitalized Victoria County residents who are currently under the care of a hospital. 1 male in his 30s, 1 male in his 80s. Want to address those when we look at the cases, not only in Victoria, but we also look at our region. And we speak of the region, and there's been some confusion a little bit on what we consider our region. We look at our region as what's called the Golden Crescent. When it comes to hospital care, healthcare facilities, and public health, those counties include Victoria, Calhoun, DeWitt, Goliad, Jackson, and Lavaca. So right now our current case count for our region stands at 16. And that goes back, the region is important, and the case count of the region is important for us because we know there's travel from those areas, from those counties into Victoria, and we utilize that information when we're considering decisions that the judge had mentioned previously. A little advice for folks, individuals, and workers traveling within our region. Obviously, if you can limit travel, please do that. Obviously, if you have to travel for work, that's definitely understandable if it is essential travel. Again, going back to those same hygiene recommendations, you want to make sure you're washing your hands, avoid touching your face. But if you are sick, ultimately, you want to stay home and do your best to avoid large crowds and those folks that may be sick out in the public. One question we also had was for those confirmed cases, how are those close contacts handled for those confirmed cases? Right now, for immediate family members, we ask that they isolate as well. They stay home, monitor their symptoms, and since they are considered close contacts, we're going to have them isolate in their home so they're not a potential risk to the public to spread that illness. One thing we all want to advise in addition to some of the governor orders and the local orders, we definitely want to express our concern and our advisement to limit. You want to limit social gatherings both in public, at public places, as well as private residence as well. That is just as risky to transmit this disease. If you're at home around family, around friends, gathering your home in large numbers, we want to try to limit that as much as possible to decrease the risk of spread there. Want to touch on briefly about the tests being done. We've had a lot of questions, saw some articles in the paper recently regarding the number of tests were being done. Right now, our best estimate is about 350 tests being done, that have been done for COVID-19 in Victoria. Those are through public and private labs. We mentioned previously, we had about 30 last Friday done at the specimen collection site, but keep in mind that's not the only site that we have for testing. Several private labs in town, clinics and doctors are doing that as well. Again, just keep in mind that we want to stay on course. We want to keep those recommendations for limiting your exposure in the public. Keep washing your hands. Stay home if you're sick. Avoid touching your face. And some of the points that Dr. McNeil touches on many times, really want to limit that exposure out in the public because that really is our best defense and our best weapon to stop the spread of COVID-19. and I'll pass it back to Judge.
Thank you, David. For those folks who might be just now tuning in online or watching on television, we do have six confirmed cases in Victoria County as of this morning, one from yesterday evening, and then 2 additional confirmations from earlier today. To speak further to those items, we'll now turn it over to Dr. McNeil.
Well, thank you, Judge. You know, we knew that we were going to have more confirmed cases, and we knew that we only had just a few before. And we're not surprised at that, and you need to understand that everybody has been ready for this, and we've been expecting this. We continue to analyze these cases very carefully. We do contact tracing. We do a lot of stuff through the health department to see exactly where these patients have been and what has happened. And we do that in really just for one reason, so that we can detect community transmission. So my message today is that really we are highly relying on the public being educated about this new virus and educated about the things that David had just said. I agree with everything David just said. I told him I was going to point to him and just say, I agree with David. And that's the truth. We have a lot of information out there, and we're trying to get it to you as quick as we can. There's really just one thing that I want to touch on today, and that has to do with the importance of remaining vigilant. And we have got to remain vigilant during this episode or this time in our lives. I mean, we're doing the best and really the only thing that we can in fighting this virus, and this is isolating ourselves. I'm encouraging everyone to stay home as much as possible. We certainly do not have orders from those gentlemen over there telling us to stay home, but for your own health and safety, it's the best thing that you can do. Remember, I say this every time, and I'll say it every time, it's the only thing that we have to fight this virus. So I watched a thing, an interesting information piece about the spread of this virus, and we've talked about all the ways that it does transmit, and I think we understand that. We've got to wash our hands. We've got to do those things. But I want to talk to you real briefly about the importance of avoiding crowds and basically not letting this virus spread. Remember, that's the only thing we have. And I want to talk to you about the concept of doing nothing, and really of nothing happening, actually. So when we think about this, we think about doing these things like restricting our emotions, and a lot of people have restricted their activities, and they're not able to do a lot of things that they used to do. And it's inconvenient for everyone. But we need to understand that the little things that we do now are going to have a big effect in the future. The actions that we do today are going to affect the spread of this virus probably in about 5 days to 2 weeks, usually about a week. So we're not going to get immediate gratification for what we do. In other words, if everybody stays home today, we're not going to see a drop in the caseload tomorrow. But hopefully in a week from now we will. So what will happen if we do everything right is nothing. And that's what we want. We want nothing. Usually when we do something, we want a positive result. We're not going to get a positive result. What we're going to get is nothing. And nothing means no new cases. Nothing means no increased transmission in the community. Nothing means no new deaths. Nothing means no more hospitalizations. And that translates into having more hospital beds, more personal protective equipment, more resources available for those people that do become sick. So remember that when we're talking about this, we're talking about protecting ourselves, and we're talking about protecting our families, and we're talking about protecting people you don't even know, because we've already talked about how easily this virus is transmitted. So when you think about this and you think about your actions and you think about not being able to do the things that you want to do, remember that those little things will have big results for us, especially when you consider it's the only thing that we have to fight this virus. Back to you, Judge.
Thank you, Dr. McNeil. With the newly confirmed cases from earlier today, I want to speak to and reiterate what's been said as to the vital need to follow CDC guidelines as well as our local orders we have in place. The mayor and I have the strong preference of seeking the cooperation of responsible people rather than issuing and enforcing mandates. But that requires that we all do our part and take personal responsibility. And most of our residents are doing that. And to that large majority, I say thank you. However, we do have reports of individuals out and about acting the fool, throwing backyard barbecues, circumventing the guidelines in place. It was never the intent, nor is it okay, to be having house parties and barbecues and gatherings with large groups of people. This isn't like Hurricane Harvey when everyone was sitting around without electricity and it was okay to get together with big groups of your friends. This is a virus and it spread from person to person. The mayor and I are monitoring all new information and confirmed cases along with our medical professionals, and we are prepared to strengthen our local orders based on new needs. But whether additional steps are implemented in the coming days, whether that's a curfew or further limitations on activities, that depends a lot on all of us being responsible. We continually get inquiries about a shelter-in-place or stay-at-home order, whether that's coming or not. As things progress, it may be that law enforcement begins proactively writing citations for the handful of violators in our community before we implement stricter limitations on everyone else who is being responsible. We have healthcare workers, law enforcement officials, emergency management officials, all working overtime around the clock to protect this community. And the last thing they and we need is to consume their time and energy with people being selfish and foolish. As of this moment, big box stores and home improvement stores are able to remain open to the community because they do, in fact, carry essential items we need to operate our households. But social distancing and crowd size should still be adhered to in those settings. We also need the cooperation of those businesses to help with crowd size and social distancing. Think about those in your family who you will expose the virus to if you're exposed to it. Are the non-essential errands that you're running worth that risk? We have to remember the most vulnerable in our population. In Victoria County, the most vulnerable are our elderly, followed by those with existing health problems. There was some comments made earlier to and throughout this process about our challenge of getting our hands on timely and accurate testing data. David gave you some current numbers. We are making progress and making great strides with getting those numbers, getting that data, because the value of knowing how many positive cases we have is in many ways relative to the number of negative tests that we're also getting. The mayor and I need to know when we hear a report of a positive case, how many negative results also came in. But as it stands now, as mentioned, we've done roughly 350 in Victoria County, and from those we've had 6 positive tests. So that's a step forward knowing those things. And again, our region, as we define it, 16 in our region. So those were a few things I wanted to remind the community of, in addition to reminding all the things that we always remind people about regarding hygiene and distancing. I again want to thank those in our community who are proactively following the guidelines we've outlined. I know that's inconvenient, that disrupts people's lives, but that is what we need at this moment, us all doing our part to slow the spread of this virus. So with that, I'll turn things over to Mayor McCoy.
Thank you, Judge. I want to reiterate the judge's point that our current order to control social gatherings due to a public emergency addresses in many ways what a stay-at-home order would. By the time you look at what's included in stay-at-home orders, by the time you define essential services and the exceptions to the orders in that, it's very much the same as what we already have in place. One difference would be the essential service. You can buy food, household goods. What you may not be able to do is go buy a new shirt at a place that's all they have. But in the most essential ways, what we have in place really does about the same what a stay-at-home order would do. The key in all of this is the public has to take responsibility. They have to take responsibility for their actions on a daily basis. We can't order a person to do what they're supposed to do in every instance. We don't have enough people out there to follow people to make sure they're acting responsibly. Yesterday, I witnessed when I was going home, I noticed a group playing golf. And they're sitting there side by side on carts. Two people sitting side by side on carts, and then huddling up on the tee box, preparing to tee off. And all I can say to somebody like that is, what on earth is on your mind? What are you thinking? Do you not listen to all of this information that we give you on a daily basis? You need to be responsible. You have the right to do what you want to do when it affects you only. But you don't have the right to do what you want to do when you affect other people. And when you affect other people in a way that it could take their life. So I'm asking people to wake up. This is a serious matter. It needs to be taken seriously. And you need to do everything you can to be a responsible adult. And so, excuse me if I get a little firm, because it really gets me from time to time what is going through people's minds when you see the seriousness of what we're facing. So at the end of the day, the same things that I've been saying over and over and over when I've sat at this deal are the three elements we talk about. The three elements about gathering size, social distance, and sanitation. That's all we have. That's all we have to deal with right now in this deal, whether the judge and I ask you to do it or whether we mandate that you do it. So please, please act responsibly. Grow up, do what you're supposed to do. Thank you.
Well said. Thank you, Mayor. We can go ahead and open things up for Q&A for any questions we might have today. For anyone up here.
Sure. As far as the VISD, they said today that one of their staff members has tested positive. Are they included in that 6-person case count that we have currently?
To my knowledge, yes. I'll let Dr. McNeil speak to that.
Well, actually, the question was the person that was confirmed positive at VISD? Yes, that was in there. David, do you want to add anything to that?
No, that's
pretty much
correct.
straightforward. Yeah, that's right.
Are you guys able to give us an identification as to which one of the 2 people or 3 people of the new cases that person is?
David, do you want to?
No, we can't identify
Okay.
as far as specifics on which one that is.
If it's a VIC employee, were they from the meal distribution?
The question if the VISD employee, if they were a member of the meals distribution, we don't have that information at this time. I know VISD was aware, and I think they may have addressed one of those issues in their press release. I can assure you, though, on our end, on the epidemiologic contact tracing, we have already reached out to those high-risk individuals. So if you're at high risk to come in contact with a person, they've been contacted already and advised. And that investigation is still ongoing for these 3 new cases, but that initial immediate high risk has already been addressed. So if an individual was at a high risk, they've been contacted at this point.
There was also UHB, I believe, issued a statement saying that one of their students was awaiting a test. Has that person received that test result back yet, to our knowledge?
I'm not sure on that individual. Sorry. The question was, has the UHV student that was tested received confirmation of that test yet? And we're not aware of that one specifically.
I might add, concerning on our testing, the results of that it's variable because it goes through a bunch of different labs now. We have several commercial labs, and I've seen lab results come back. I saw one last week that was drawn at 4 o'clock or obtained at 4 o'clock in the evening, and we had it at 8 o'clock the next morning. I also have some that I didn't get back for 7 days. So it's variable. I think it depends on their volumes and which lab it goes to.
So just to clarify, just as to our knowledge, that person, the UHB student, is not included in that case count?
That we can guarantee. We would know about that, yes.
Yeah. And if they are confirmed positive, then we'll definitely communicate with the public.
And as to, I know we talked a lot in this meeting about the stay-at-home order, where we're at with that. And I mean, is there a certain number of cases at which a state, like we can say definitively at which a stay-at-home order would be issued?
Sure. Well, the question is there a certain number of confirmed cases at which we would issue the stay-at-home order, or that would be a trigger for the stay-at-home order? We've spoken to that issue. That's something we discuss a lot behind the scenes, what would cause us to take that next step. We're really not able to put a specific number on it. We have identified moderate community transmission as the threshold that we would look at doing something like that. But we would really need the information and with each of those confirmed cases to be able to make that determination. The details of every case matter. The details of every patient matters. And so that's not something we can put a hard and fast number on. But I would go back to the comments we've spoken to before. The actual effect of what we currently have in place compared to the intended effect of other communities' stay-at-home orders. In many ways, what we have in place with our social distancing order, we're accomplishing the goals that other communities are trying to with a more stringent order. But again, the key for that to work, the key for all of this to work, is for people to do what they're supposed to do, to take responsibility and follow guidelines, CDC guidelines and the orders we have in place.
And I will add one more thing on that, Judge. As far as the new cases, we have determined in most likelihood that 2 of the 3 new cases are travel-related, and they are not community transmission. The third one right now is still pending investigation, and that's domestic travel.
And add a little bit more to that.
Yeah.
The thing about everybody wants a number that we can pick, and if we say, okay, when we get 12 cases, it's moderate, and we're going to do this or do that. It's really a lot more complex than that, because if you can look at, say, 5 cases. If we had 5 cases that were positive tomorrow, if we looked at every one of them and they all had traveled to an endemic area and they came straight back and they were isolated, we would say, okay, that's 5, but those 5 cases, we know where it came from. We know that they're isolated now. We know that most likely they did not spread it any further. As compared to 1 case that may come back and we have no idea. They didn't travel. They've been in the community. They've been to every food store in town. They go out with all their friends every day. That would be a much more concerning thing. So there may be a number lower that would indicate moderate community transmission as compared to a higher number if we can do that. And that's all done by epidemiology, and so it's more than just a number. It's every individual case looked at very intensely. It takes several hours just for a simple contact. Sometimes they look at a lot of different factors.
Yeah, and I'd add on even further to that, that when these cases emerge is also a consideration. Because as new cases are confirmed, it's quite possible that going forward you have previously confirmed patients who are recovering. In many areas around the country, you're seeing more people recovering than people being confirmed with new cases. So those are all things that weigh into the equation, but certainly the mayor and I are relying heavily on our medical healthcare professionals. But the details of these things do matter, and that's what I always re-emphasize when somebody asks the question. I wish we could give a specific number and make it that simple, but it's really not.
And it's like every morning, basically, we come in at our policy meetings, and we're talking about these issues, about what is going to be our main considerations. We work on drafts of certain orders. We read orders that other communities put in place, because you can't put out something like that in a haphazard way. You have to put out, whatever you put out has to be effective. But I'm still go to the point that there's nothing that the judge and I can draft and create that will take away the need for people to be personally responsible. And I can't emphasize that enough. Again, whether we ask you to do it or mandate you to do it, you're the one that's going to have to do it at the end of the day. So that's what we want to tell people, to pay attention to what you do. think of everything what you do, but the most important thing, don't just think about yourself. Think about what your actions do to impact the very lives of other people. And maybe you'll have a different perspective on what you decide to do.
On that point, I heard you mention something about the possibility of further enforcing like citations.
That's right.
Up to this point, have there been any citations issued for gatherings of over 10 people?
Not to my knowledge. As of yesterday, there had not been. The feedback we're getting from law enforcement is that there haven't really been big enforcement issues. I do know that we are hearing some reports now, though, about these house parties and barbecues with a large number of people present. Those are things that increasingly law enforcement will respond to. Thus far, there really hasn't been enforcement issues, but we are now hearing reports about that. And I think our law enforcement folks will be able to speak better to that whenever they're here, maybe tomorrow or the following day. But those are things that I think will need to give direction that they take increasingly serious, because again, as I've said, if there's a weak link in our community effort to follow these social distancing guidelines and crowd size guidelines, it can undo everybody else's sacrifice and effort. In my mind, I would like to see a more proactive enforcement of that small group of people who are not following the rules before we step to the next level and put more stringent constraints on everybody else. And I would see that as our sequence of steps going forward.
And I would almost guarantee that it's probably going to be the same small group of those people, whether under a mandated order or a voluntary order.
As to the two of the new cases that are related to travel, was it within the Golden Crescent area, or is it to some of those outside hotspots?
Yeah, all we can disclose is we just can determine if it's international or domestic, and they're both domestic travel. So inside the U.S.
And then today with the case, the marts were the possible, the Joe's Mart.
Yes.
So that was identified as a low risk possible transmission. What makes it low risk, like as opposed to a higher risk interaction? Like what about that?
So-
If you
Sure.
can repeat the questions
Sure.
for
Yes, sir. So the question was regarding the press release we sent about an hour ago regarding the Josephina Mart transmission being low risk and kind of what determines that. Basically, a lot of it is how close that infected individual is with crowds, the prolonged exposure to certain people. Also, at that time in the illness, if they were how contagious, if they were coughing a lot, or not so far along in the disease to where the high risk of spread was taking place, and really just kind of what they were doing. If on that one, I don't know the details, but we have a time frame that we can kind of put them there at that facility during those times. We're going to say there may be some possible low risk exposures to people in that establishment during those times, and we've advised and we discussed with them. With the establishment that they're going to clean. They have been cleaning since that time, and so they're doing their part and being responsible to make sure that spread doesn't take place any further.
And another question or reader question that we have is with trade work still active in our area, like plumbers, electricians, and tradespeople, do you guys have any advice for those workers that are still going into people's homes on how to stay healthy?
As far as, I think that would go, the question was as far as trade workers such as, who did you say, plumbers, electricians, things like that come into your home. Pretty much the recommendation is to stay at home whenever possible, but people have to work, and that's understandable. We would always encourage any worker, if they're ill, to please not go to work, because remember that you may not know you've had this virus, and it can be you can be shedding virus for several days or a week or even longer before you even know you're sick. So that's what happens during contact tracing when we go back and we look at this. We look at the day that the person became ill, and then we try and see where did they go, what did they do. If they've been in 12 different people's houses fixing something, then those are 12 households that we need to look at for the possibility of transmission of this disease. So we encourage people first not to do anything when they're ill except stay home. I know personally in my house, I can tell you that my shower doesn't work right now. And we were going to have a plumber come fix it, and he called a couple of days ago to come fix it, and I told him, why don't we wait until after this is over? I just think that's prudent. And if you're isolating yourself at home, to me, personally, it doesn't make a lot of sense to have other people that you don't know their history coming into your home. So I would throw that out there. That's another personal decision, but that's just the way I handled it based on my knowledge.
I want to clarify something briefly. I've mentioned the backyard barbecues, house parties. I think one reason why we're seeing that, in our current order, we specifically exclude from the definition of social gatherings private residences. So currently, those activities are not prohibited in the order we have. There's lots of issues that arise when we're dealing with somebody's home, somebody's house. But again, back to the point of personal responsibility. In excluding residences from the order, we did not intend to indicate that these big events are okay. Even though under the current order in place as of right now, residences aren't under the definition of social gatherings, the 10-person limit should be adhered to. The question was earlier about citations. Have any been issued? Well, in this instance, they wouldn't at this point because they're not part of that definition. I hope we don't have to take further steps that would include places like that, but currently those are exempted from the definition. But responsibility, prudence should still apply. Groups of 10 or more, you shouldn't do that. That really undermines everything we're trying to do. And like I said, we have gotten some reports about that. Not every report that comes in is accurate. I know that reports have come in and law enforcement have gone out to respond to that, see what was going on, and it was inaccurate, the call that came in. But in general, we go back to personal responsibility, the crowd size, the social distancing. Anything else this afternoon? Any other questions? Okay, if not, I want to thank everybody again for tuning in for your time and attention. The best source for up-to-date, accurate information is victoriatxoem.org. The hotline number is 361-580-5796. This should be replaying on channel 15 or 115 at 6 p.m. today. For anyone with unmet needs in our community, you can call 211 to connect you with resources. Again, for those who may have just now started tuning in, we have 6 total confirmed cases in Victoria County. We're not currently under a curfew or a stay-at-home order. Those 6 confirmations are out of roughly 350 tests that have been conducted thus far. And again, the mayor and I believe the orders and guidelines that are currently in place still sufficiently mirror the conditions in our community and will sufficiently slow the spread of COVID-19. The mayor and I remain in constant communication with the folks up here as well as other professionals, healthcare professionals, both with the county and within the community. We'll again have another press briefing at 3 o'clock tomorrow. I know we had to start this one a little bit late today due to the governor's press conference, but we will again resume our 3 o'clock schedule starting tomorrow. So again, thank you all, and we'll see you tomorrow.